morning. We don't have quorum yet, but perhaps others will join in the next few minutes.
Sounds good. All right. If we're going to record the meeting, if somebody could push the magic button to record, if we haven't already. Excellent. Well, good morning, everyone. This is JJ Rico, Vice Chair of the Council, also CEO for Disability Rights Arizona. I'll call this meeting to order at 10:06 a.m. on November 21st, 2025. I'll be chairing the meeting in place of Melissa Van Hook. Thank you all for those who are able to come. At this point, we don't have quorum. So on the action items, we'll table those for later discussion and vote if we don't obtain quorum, but we'll make our way through the agenda regardless. If we could do a roll call just to have an official account for who's here, if Marcy, you could help me with that.
Absolutely. Good morning. So JJ, you just introduced yourself. I'm going to move on. Monica.
Excuse me, Monica Cooper, council member, chair of the grants committee, self-advocate.
Thank you. JC.
Hi, JC Farkas from the Sonoran Center for Excellence in Disabilities.
Thank you. Eric.
Eric Jensen, community advocate, member of the workforce committee.
Thank you. Kathy, you can hear us, Kathy.
Kathy Lewandowski, family member, chair of the
Work plan. I think we lost her.
Yeah.
Okay. We've got you, Kathy. Vijay.
Good morning, Vijay. Sorry, family member.
Mateo.
Good morning, Mateo Treetop, self-advocate.
Great. Jeff.
Hi, Jeff Studer, Arizona Department of Education, Exceptional Student Services, right here.
Thank you. Mary.
Hi, Mary Slaughter, a council member representing a woman who was previously institutionalized.
Great. Thank you, Mary. Ken.
Good morning, everyone. This is Kim Cowles, council member. Nice to meet everyone.
Great. Thank you, Ken. Kristen.
Good morning, Kristen Mackey, RC administrator and member.
Okay. I don't see any other council members, so we're getting close there to a quorum. I'll move on to staff. John.
Good morning, everyone. John Myers, Executive Director.
Michael.
Good morning, everyone. Michael Leva, Contracts and Grants Coordinator.
Sarah.
Good morning, Sarah Ruth, Communications Director.
Jason.
Good morning, Jason Sneed, Research and Communication Specialist.
Lonnie.
Morning, Lonnie Sates here, Fiscal Manager.
Okay, I'm Marcella Crane, and I'm going to move on to guest. Okay, so Justin, can you introduce yourself, please?
Sure. Hi, all. Justin Harris. I am a section manager at the Arizona Department of Environmental Quality and have worked many years in the disability-related fields, and so excited to be with you guys and just really appreciate being involved. So thank you so much.
Thank you, Justin. Leah Landrum-Taylor.
Good morning. I am Leah Landrum Taylor, LT is what everyone calls me. I am the Assistant Director with our Department of Economic Security. Glad to be here to hear all the great things going on with the council. And this particular council now reports into the area that I supervise. Thank you.
Thank you. Welcome. And Jesse Barbosa.
Good morning, everyone. Jessie Barbosa, former council member awaiting reappointment, and I work at Disability Rights Arizona.
Terrific. Thank you, Jesse. Anyone else that I missed?
Alexander.
Oh, sorry. Alexander, our intern.
Yes.
Alexander
Martinez. I'm one of the current MSW interns at the council.
And Megan is on.
Thank you. And then who else joined?
Megan Donahue.
Oh, and Megan. Sorry, Megan, you are on. I forgot you were joining us. You are our main presenter.
Hey everybody, I'm Megan Donahue. I am consulting with you as a member of the Institute of Human Development, helping with your state planning process.
All right, I think I got everybody. JJ.
Thank you, Marcy. Thanks for the help. We'll jump through the agenda. Although we can't approve the minutes at this point, are there any edits or comments related to the minutes so that we can, when we do have a quorum, we'll take it upon a vote? Any feedback on the minutes, any edits that are needed? Hearing none, we'll table that for now, and we'll come back to item B, approval of the minutes if we obtain a quorum. So we're jumping ahead the agenda, and I was reading it on the screen. So I'm guessing we're going to talk about financials next, Lonnie.
Thanks, JJ, and thanks for presenting, John. This is the financial update. The council received a total allotment of $1,501,328 for fiscal year 2023. A no-cost extension for the period of performance was granted through September 30th of 2025. The council has fully liquidated these funds. The council has received a total allotment of $1,500,684 for fiscal year 2024. The obligation period was through September 30th of this year, and the council has fully obligated these funds. The council requested and received a no-cost extension for the period of performance, which now runs through September 30th of 2026. However, I don't think that we're going to need that no-cost extension. Right now, the sheet shows that there's approximately $87,913 remaining to be liquidated before September 30th of next year, so 2026. However, we received several final payments for projects that ended this last September. And so that total now in the system is closer to $4,000. So we're good on the liquidation front for 24 funds. The council has received a total allotment for fiscal year 2025 in the amount of $1,497,106. The obligation and project periods are through September 30th of 2026. The council has fully obligated these funds, and there's approximately $985,858 remaining to be liquidated. The final report is due January 28th of 2028. We are not anticipating a no-cost extension for these funds, so it's kind of essential that the work get completed by next September. So September 30th of 2026. During the executive committee meeting, there was approximately $15,330 over obligated. However, with the final invoices coming in and an expenditure correction being made, this is no longer the case. However, any overage with obligated funds can be used with 26 funds once they are received. Due to the government shutdown, we have not received any funding for federal fiscal year 2026 yet. We were told prior to the shutdown to expect level funding. These funds will be used primarily for 2027 projects. These projects will need to be determined as part of the new 5-year state plan. So we really don't have the goal areas determined yet. And so there's time for us to figure out what to do with 2026. Unfortunately, we have not had word as to what's going on with those funds. And typically at this point in time in the year, it would be showing on this sheet. But again, the government shutdown is kind of putting things behind. Any questions on this sheet? Okay, moving on to the council-funded projects. This sheet shows all the current projects funded by the council. All the new and continuing projects voted on during the last meeting that we held in September are reflected. However, many of the contracts have not been finalized yet. So the work has not been started and the obligations have not been set up in the system. However, they are reflected on the reports and will be updated when finalized. Final invoices for the projects that ended in September 30th were due last Friday. So November 15th, these invoices were processed this week. So nearly all of the fiscal year 2024 funds have been liquidated, even though it's not shown on the sheet. So I did this on Monday. Payments have been processed. We now have approximately $4,000 left in 2024 funds. Any questions on this sheet? Okay, moving on to the final sheet. This sheet has been updated to reflect the projects outlined in the fiscal year 2026 work plan. So the work that we're doing right now, as well as the funding that has already been approved in the prior years. The funding year is generally the year prior to the project year. For fiscal year 2025 funds, these will be used primarily for the project completed in the fiscal year 2026 work plan. So again, what we're working on right now. The administrative budget has been increased to reflect the work to be done as part of the comprehensive review and analysis, as well as the 5-year state plan updates and creation. This sheet will be updated with fiscal year 26 funding once it is received and when we have determined what the new goal areas are going to be for the new 5-year state plan. Any questions on this sheet? Okay, that's it for me. Thank you.
Thank you, Lonnie. Any questions at all? I know Lonnie paused after each sheet. Any questions about financials before we move on to the next agenda item?
Can I ask a question of you, JJ?
Of course.
Have you heard anything about 26 funding on your end?
Not exactly. We just so for the full council to know, we are funded by the same administration that funds the council. And no, but we do have a meeting scheduled with our primary program officer. I think it's the week after next, which is good news, obviously, that they're still there. I'm in their proposed agenda, there was a discussion about funding. So, but I will say for the other departments, we are also funded by the Department of Education, which we've received an email indicating they're processing them as quickly as possible, what that means. And then we also funded by Social Security, another federal agency, and they said actually they're going to probably issue notice of grant awards maybe as early as next week. So each agency is probably moving different. We also did have a phone call with a program officer from SAMHSA, which is the Substance Abuse Mental Health Service Administration, who also funds us and oversees one of our programs. They said they're working on it, but gave no date. So I guess that's 3 out of the 4 agencies saying they're working on it, but unfortunately the one we hadn't heard from directly is ACL, or Administration for Community Living. So short answer is no, but long answer is seems like they're working on it. But what that means, the only other thing I'll say from our national office to us is to anticipate 8 to 10 weeks from the time they pass the budget, with other CEOs thinking it might be as long as 12 weeks because of all the work that they're coming back to being furloughed, and then also maybe some staff not returning that used to calculate or issue those awards. So maybe more information than all of you wanted to know, but since we do, at least at DRAZ, touch so many federal agencies, I can tell you all of them are saying kind of the same message of as soon as possible with varying degrees of how soon. So thanks for the question.
Thanks for the insight. Appreciate it.
Of course. All right, well, we'll move on to the Executive Director Report, item D. That is John Myers, our Executive Director.
Okay, thank you, JJ, and good morning, everyone, again. Just a couple of things to go over, hopefully very quickly. The federal budget, as we've just been talking about, there is a federal budget in place. I do want to add a little note to that. Certain portions of that budget, as you probably know, were funded for the remainder of fiscal year 2026, things like SNAP and a few other programs. Other elements of the budget only run through January of 2026. And so we are essentially under a continuing resolution for a great many aspects of the federal government. And we don't know exactly how that's going to play out. We have been told to expect level funding for this year, but as Lonnie mentioned, we have not received a notice of award. So it's still sort of a waiting game for us. I'm certainly not panicking, and I don't think we have any reason to panic. We also have a meeting with our ACL representatives coming up on December 4th. And at that meeting, meaning the executive directors of the councils around the country, we should be receiving some additional insight into the status of our funding. But as JJ mentioned, it could be a while before we actually see those notices of award. So hang tight. We'll fill you in as we know more. Regarding our fiscal year 2026 work plan, the last time we met, we had not received approval. We met on September 24th, I think it was, we had not, or September 26th, we had not at that point received approval of our 26 work plan, which was to go into effect October 1st. Interestingly, just before the federal government shut down on October 1st, we received on September 29th approval for our work plan. So we are in good shape to proceed, and we are proceeding with the plan that you all approved back in August. Yes, that was submitted to ACL in August. So we're good to go. Regarding our program performance reports, which, if you're not familiar, are the annual reports that we are required to submit by the end of December to the Administration for Community Living. We submitted, we got an extension last year because there was some difficulty getting a new reporting platform in place at ACL, and so they had to come up with sort of a makeshift solution for us that was not given to us really until after the first of the year. So we had until March to submit that report. We did submit that report on time, but we have not yet received approval on that report. So we don't have any feedback. I was given an indication at a meeting that I attended at ACL back in June that we would be good to go, that there were no serious issues, no questions, nothing we needed to remedy. So based on that, that oral feedback, we assumed we were good to go, but we haven't received anything in writing, and we typically do receive something in writing. It's not a big deal, I don't think, but just to let you know that we don't have that formal approval of the FFY 24 PPR. We are now in the process of preparing our FFY 25 PPR, which is due December 30th. We were uncertain because of the government shutdown if there would have been an extension on that because the ACL staff were out of the office for more than a month and we had not been provided the reporting platform for this year. But we did just hear this week that we're using essentially the same reporting platform as last year, and we will be held to that December 30 deadline to get the report in place. Fortunately, we as a staff had been anticipating that it would be December 30th, irrespective of the government shutdown. So we've been working on it according to schedule, and we will have that submitted on time. The issue of access and DDD's assessment and eligibility requirements for primarily for the pediatric population who receive DDD services is one that's been very much in the news lately. You are probably all very well aware of the fact that new eligibility requirements and a new HCBS needs tool were put into place effective October 1st. You're probably also aware that on October 16th, the governor put a pause on those assessment and eligibility changes after pretty substantial outcry from the DD community around the state. We as advocates are trying to work with the governor's office. We are trying to work with Access and DDD to come up with some solutions. There were some serious issues with the tool that was put into place. And I would remind everybody that new tool was put into place because the legislature mandated it when a supplemental appropriation for DDD was approved last April. So they required that some new assessment and eligibility standards be put into place, that ideally some standards would be put into place that would reduce the cost of services to the state. The problem with doing it so quickly, with doing it really in less than 6 months, was that there wasn't adequate time to receive public comment. There wasn't adequate time to take into account the clinical input that was required to understand how assessments should be done. There were a whole host of problems, and Access and DDD are now working on correcting those problems, and they have issued a revised tool for public comment. The public comment period is only open until next Monday, so it's fairly brief. If you are interested in making comment, please do so this weekend. 5:00 p.m. next Monday is the deadline. They anticipate that they will take into account public comment and reissue, if necessary, a further revised tool sometime in January, which I believe they are hoping will take effect February 1st. There's no guarantee about that. It's all very squishy right now. But in the meantime, while they are further revising the tool, all of the standards that were in place prior to October 1st apply. So any level of services people were receiving prior to October 1st, they should still be receiving. And redeterminations, eligibility changes. None of that is expected to really take effect until after the new tool is formally put in place again. I would say from a personal standpoint, I'm pretty sure that even with the further revisions, even with the public comment, the tool that gets announced next year is unlikely to be substantially different than the current tool. It will provide for more exceptions. It will provide for more appeals, which in themselves could be problematic, could delay implementation, but are probably the right thing to do from the standpoint of need and the services that children should be allowed to receive. But we all have to bear in mind that the whole point of this was to save the state money. So the state is going to do what it needs to do in order to cut back some of the costs of our service system, which are pretty extensive. So we'll provide you more information as we learn more. It is, it's a controversial issue, and it could end up meaning that certain families, certain individuals receive fewer services than they are now, fewer hours of service than they are now. And it's an unfortunate situation. I know that Disability Rights Arizona is doing everything possible to make sure that people receive everything they are eligible for. We too will be advocating for that, and we know that there are a great many other advocates around the state who are doing the same. On to the last item, which is the Rural Health Transformation Grant. You may be aware that as part of HR 1, which was passed by Congress and signed by the President back in July, there were some really extensive cuts to Medicaid funding by the federal government, which would disproportionately affect rural communities and rural healthcare providers. As part of that bill, there was a scheme put into place to provide some funding to try to make up for what was going to be lost through the Medicaid funding. And recently, Access, the Department of Health Services, and the governor's office put together a grant for what is known as the Rural Health Transformation Program. That grant has been submitted, or that grant proposal has been submitted to CMS. And by mid-December, I believe they are anticipating a notice of whether or not Arizona will be receiving funding. It is a $1 billion grant request over 5 years. And so $200 million a year over 5 years. It's a pretty complex proposal, lots of different parts, lots of moving parts in it. But ultimately, the goal is to provide some innovative solutions to providing health and healthcare in rural areas of the state. We, of course, have an interest in that because many of the members who are served by DDD, by Altex, the people we represent, live in rural parts of the state. So we will be staying attuned to what's happening there. And we will continue to work with the governor's office, with Access, with ADHS, with whomever is relevant to ensure that the needs of Arizonans with disabilities living in the affected communities will be taken into account as new projects, new innovations are put into place. I'm going to finish there. I'm happy to answer any questions you all might have. Okay, thank you very much.
Great. All right. Thank you, John. Appreciate the report. Just a side note for me on terms of the Access and DDD assessment tool, I think John noted right now is the comment period. So if you all are interested in participating in that process, is the public comment process. So that means anyone can share how the proposal can impact them, their children, or someone in the community. So that process is open now. So thank you, John, for the thorough report. Item E is a presentation. I just wanted to pause real quick just to make sure we have not obtained a quorum. Has anybody else come into the meeting that was not previously here? Not. Okay. Well, then we will proceed with item E, which is the ADDPC 2027 to 2031 State Plan Development. We have a presenter, and Megan, I see you now on the screen. Megan Donahue. The floor is yours.
I am going to steal John's screen share, if that's okay.
Absolutely.
So let's see. You should be able to see a slide. Is that the case?
Yes.
Okay. So for those of you who either don't know me or don't recall me, I am Megan Donahue, and I am an evaluation associate with IHD. And I joined IHD just over a year ago. I telecommute from Wisconsin, and I come to you with a background in serving people with assistive technology for nearly a decade before I went on to get my doctorate in systems engineering. And I used to be heavily involved like in the Rehab Engineering and Assistive Technology Society of North America as well. And so I kind of come to you with both a service provider lens and then this evaluation lens and research and evaluation skills, and put them together. And I have a very strong service oriented and team approach to all of my work. And what you all brought me in to do was to start with conducting a comprehensive review and analysis of the landscape of disability services in Arizona. And this is a required component of your state planning process. And so what that looked like was we did 3 different phases. And so we had the first phase that was really trying, or I should also say, we're getting that landscape of the services for IDD in Arizona, but we're following a template that was provided by the Technical Assistance Center, ITAC, with all these different required domains. A lot of that is built off of the legislation around your funding. And so what we looked at was several core systems, demographics and prevalence data, most of that in the American Community Survey. We're looking at healthcare, employment, formal and informal supports, interagency initiatives, and quality assurance. Those, the first, all of them except quality assurance, were required domains. And so we really went into depth, answered all of their guiding questions. And then the other ones that I'll talk about in a moment and quality assurance are optional domains. But because of all the work that you do related to safety, we decided to do that into depth. So phase 1 was looking at all the reports and websites and everything we could find that's written down somewhere to really answer these questions. And then new this year compared to previous state plan cycles was a much higher degree of community input into understanding these needs in the landscape of services and priorities of the public to help ultimately all of this informing your data, or giving you a data base that you can then inform your decision making as you set the priorities for the state plan development, which we'll get to later this morning. So, so with the report, you know, phase 1, like 100 bajillion pages, and it's really going into a lot of this depth. And then the less covered areas are education and early intervention, housing, transportation, childcare, and recreation. It gave us a great foundation of knowledge, but it's what's it polished up and pretty in reports, and it doesn't give a full, well-rounded perspective. So we did 2 other things to gather public input. One was surveys, which is phase 2, and then phase 3 was community conversations. So in the surveys, what we did was we provided one URL with 2 different surveys in it, and then people identified their relationship to the world of IDD, and that helped decide whether they got the individual experience survey or the organization survey. The individual experience survey, we collected 203 individual experiences, and those were people with IDD, family members, caregivers, and it really explored their personal experiences with finding healthcare, employment, support services, looking at availability, ease of access, timeliness, and then what they felt was an area for needed improvement. We also did an organization survey, and that collected 158 different organization representatives giving their perspectives. So 10 could have been from the same organization, but they're still looking at it from more of a system level, looking at the barriers and needs in their local communities, how well services are meeting the local community needs, what the barriers are to receiving services, and challenges in service coordination. And then their lens, again, from that higher level of what needs to change to make the system better. Phase 3 is 10 community conversations that we held, 8 of them across Arizona in person and 2 that were virtual. This gathered over 125 different voices. They came from family members, caregivers, advocates, and community representatives. And these conversations gave everybody a chance to share their perspectives on the resources and needs that are related to healthcare, employment, supports, quality assurance, and the coordination between this organization. So those 5 deeper dive areas. And with all of this, what it does is those 3 together combine into what the CRA is. So there have been 3 interim reports written, summarizing and going really into depth of the data collected in each of those phases. And then the final CRA that we're still in the process of developing aggregates it all together. It follows the state plan template because we have to copy and paste it into the state plan, but it also comes together to give that full picture that I am gonna, in a moment, share the findings of to help really drive those conversations. I should note before I get too far into this, that my current view does not allow me to see any of you at all or chat. So somebody needs to interrupt me if hands get raised or questions or anything like that, and you are welcome to do so. So we have 3 different phases, bringing it all together, and that's the results that I want to share with you today, is bringing the results of putting all of that together. So I have a very pushy coworker that you're seeing bump my arm right now, my dog Chase, and I apologize for that. So well, I'll get to it in a minute. So with our results, first, just touching on that demographics and landscape. The prevalence of IDD is 1.58%. That number comes from 2001. And then we multiply it to the Arizona population. As you're all aware, there's a lot more awareness and understanding of IDD over the last 24 years that is not captured in that prevalence rate. However, there's not a better one that's been published that captures all ages. That being said, we know that there's 8.56% prevalence rate for children in the age of 13 to 17. So we could maybe think about extrapolating that out a little bit. We also saw a higher disability prevalence, not IDD, but disability in general, in older adults, American Indians, and white populations. Now, the way the American Community Survey captures disability is they ask a whole bunch of questions about functional capabilities. And then they infer disability with that. And that helps the survey overcome all of the different cultural barriers of whether somebody may identify as a disability or not, and normalizes it a little bit more. And so our state is overall racially and ethnically diverse. We have 31% of the state that identify as Hispanic and Latino. And so there's a mismatch in some of the proportions here. I'm also going to mention in the materials that John gave you is a Word document that summarizes that these slides were built off of, if you wanted to refer to that for a little bit more context. So most of the individuals with IDD who are receiving services are getting them through DDD, Access, and Alt-Text. And as of mid-2024, DDD served over 56,000 individuals. But more than half of the population is not receiving services. We don't have a strong statistic on that, but just by inferring off of the prevalence rate, we're seeing that DDD is not reaching everybody with IDD. And then I want to note, as I go through all these responses, that there are some biases. In particular, we have all those reports that put shiny fronts on sorts of things, and we don't get the full well-rounded picture. And then we have our survey data was really heavy with responses in Maricopa and Pima counties but not in the rest of the state. And same with our community conversations. We had 8 of them across the state and 2 virtual. We just got little pinpoints across the state. We didn't really get the full breadth of the perspectives. And so that really limits some of the insights that we can get. And then in particular, we did not get a lot of input from rural, tribal, and non-English speaking communities, especially in the survey responses. So just want to kind of put that lens as we look at these results, okay? So overall, service availability, access, and timeless was very regionally, it varied a lot regionally based on the service types as well. We did see more barriers in the rural and tribal communities, including transportation, provider shortages, and more fragmented types of resources. Specifically related to the topic of healthcare, there was difficulty finding the specialists in general. Having providers that understand IDD was hard to find. And then insurance coverage issues we saw, there were some cultural barriers. We note that mental and behavioral health services were really limited. There were long wait lists, and there's a lot of provider turnover, and that has some big systemic effects that we'll talk about later. In the realm of employment, there's lots of employment supports that exist, but overall the sense is that there's a general lack of awareness and understanding of them. There's stigma to be overcome of what the capabilities are of people with IDD, and that comes at a lot of different levels of, you know, job and employers understanding they can hire, but then also people recognize, like people recognizing the opportunities that they're looking for. Okay. There's limited job opportunities, limited opportunities in general, and then still a lack of transition supports. And then we'll talk more about assistive technology when we get to the state issues and challenges, which is a separate analysis. But in the employment realm, that's scarce. And that could also be, as we'll talk later, about awareness. And formal and informal supports, you know, there's a lot of formal supports and informal ones, and they're valued. So you've got DDD, you have Encircle Families, there's lots of advocacy groups, there's support groups that are there. But there's a lot of gaps in caregiver support, respite care, education, and this is awareness of how to like manage the system, service coordination, all of that is areas of weakness. And then there's some systemic barriers that really come up, and these are things that really the community felt needed to be addressed. A lot of these are coming from the phase 2 and the phase 3. So there's the difficulty navigating the complex systems, and coupled with that is that lack of awareness of the available services. And those were the top barriers that were identified by the individuals and by organizations. Workforce issues, low wages, these are a lot in the direct support services, low wages, high turnover, insufficient training, and that's really affecting the quality and availability. You know, 3/4 or so of the organization respondents said staffing is a significant issue that's affecting that service delivery. And then there's wait lists. They're happening in therapies, respite, recreation. I'm not saying official wait lists that you officially get put on, but just longer waits that people are having to receive the services that they want. And then there's a lot of isolation happening within the services and agencies, and that's limiting the collaboration, communication, and it really is making it overall more difficult for our people. We have to touch a little on underserved populations, and it's something to think about. And I was really intentionally non-prescriptive in what underserved meant. And I actually, in the phase 2 and phase 3, really reached out, in phase 2 in particular, it came up in phase 3, is I said, you know, are there underserved groups? And then I had the respondents identify them. And so what we're seeing is rural is underserved, non-English speakers, indigenous communities. We're hearing that those with complex or co-occurring conditions are underserved. I've got more reflection on this in the state issues and challenges of a couple other groups that have come up and been spoken about as well. And so, so we just have to recognize that there are these underserved groups. And then the community voice, you know, it was emphasized, you know, there's nothing without us, nothing about us without us, you know, and the importance of advocacy and inclusion and how it can reduce stigma, how it can promote independence, and the need for continuous improvement in this area. So overall, across all three sections, you know, there were some general calls to action for improvement. So I guess I didn't know if I can't recall if I said this, but the CRA, the final report, is actually a public facing report. And so, and it's wide. It was meant to give you a lot of great information to support your decisions, but by making it public, it also gives this call to action that other people can work on and cite and look at too as well. And so some of these may be outside of the scope of the council. We're going to set our scope later. Big one, strengthening workforce development, investing in training, investing in retention, getting competitive wages out there for the providers, and then developing specializations for our underserved populations. Specifically in some of the survey responses was, you know, getting more proficiency in other languages, particularly Spanish and American Sign Language. Expanding access and reducing barriers. So increasing service options in the rural and tribal and non-English speaking communities. Transportation came up over and over again in the community conversations, and it's just so intertwined with everything else. And then improving access to mental health, behavioral health, and therapeutic services. And this came across all three phases. Figuring out what efforts could be done to simplify system navigation and coordination. So there needs to be more outreach, education about available services and increasing that awareness, and then some coordinated multi-system guidance and better collaboration between the agencies, providers, and community organizations. And then promoting advocacy, inclusion, community understanding. So reducing that stigma really through public education, provider training, ensuring people with IDD have a voice in the policy and program development. I feel like this one preaches to the choir of something that you all know near and dear to your heart. And supporting self-advocacy and leadership opportunities. And then increasing funding and resource allocation, you know, trying to get those resources directed to employment, transition programs, respite, recreation, transportation, increasing provider reimbursement rates so that they can have better quality services and more sustainability, less staff turnover. So, you know, these are big wishes, right? I'm also going to mention with all of that data, we do have some limitations. So I mentioned this earlier with some of those biases, you know, when the survey doesn't reflect all of Arizona, 203 individual experiences is a very small number. There's overrepresentation in the urban counties, less from the underserved groups. Similarly, those community conversations gave a lot of great valuable context examples, but they're limited in scope. There's some data gaps in transition age youth, adults with autism, indigenous communities. You know, that could be a call for further study. And then, you know, the system is super complex with the overlapping eligibility, funding, and program requirements. And so, you know, that really limits what we're able to figure out too. But we do have actionable insights that really surfaced from this. And so these are the really big things to think about. And so one is focusing on workforce and system navigation as a foundational levers for improvement. Prioritizing outreach and service expansion in underserved regions and populations. supporting cross-agency collaboration to reduce fragmentation and improve coordination, centering community voice and lived experience in all planning and decision-making, monitoring and addressing data gaps through ongoing engagement and evaluation. Again, all of you that really work in this, you know, these probably aren't coming as surprises to you. And that's common in a needs assessment because you're in tune with the needs. But through this CRA, we have a lot more documentation to support any decisions that get made. Deep breath, quick pause. The next thing after, like, you know, there's a prescribed process to developing the state plan. So the CRA was the big project, and we're continuing to do that. We're putting that public-facing report together. We're going to translate that report into Spanish. But the other thing that we need to do to help you with decisions is have an analysis of the state issues and challenges. So there's a lot of things that surfaced in the CRA, but there's specific things that you also want to look about and think about. And so I worked with the ad hoc committee and had a lot of good, rich discussion with them earlier this month to really get a pulse on some of these challenges that need to be thought about as well. And we're going to talk about them now. So the first one is in the realm of assistive technology. So we saw in the survey results that people were like, hey, there's not much AT, but it was really asking about it in the employment realm. And assistive technology is in all domains of life and in all parts of the lifespan. And so that was really just a really limited nugget of knowledge from the data. But what we're seeing is that lack of availability related to employment. And as we talked about it more, you know, the first hurdle to the lack of assistive technology services is awareness of it. And people don't know what AT is, let alone how to get it. They get exposure in school if it's needed at that point in their life. But then how do you get it later in the lifespan? And that knowledge and awareness is changing. And then the pathways to getting the tech, so those are changing. And then how to fund it, and whether you have the financial security to fund it if it's not something that you can go to a specific program to get that funding for it. We also talked a little bit about the changing terminology in the AT world and that it's evolving. So there's supportive technologies, there's assistive technologies, there's enabling technologies, and there's a lot of confusion with that jargon, and that's not helping the awareness either. I think about, we were talking about this last night, you know, as somebody who was an assistive technology provider and an engineer of the forefront of the technologies, you know, there's been a lot of changes, you know, where things that, you know, using your smart speakers and all the connected devices has really changed that whole landscape over the last many, many years. And so, and leaps and bounds with our current technology industrial revolution happening. Okay. Another area we talked about was lack of resources and funding in the rural areas and specifically. So the lack of funding for programs, the uncertainty of the funding is a continuous struggle. And this is particularly noted in the mental health, and that is there's extra barriers in place to those services. There's lack of training and direct support, constantly training people because of the turnover, and that lack of consistency is also creating a lack of trust. And then there's not enough, it was mentioned there's not enough oversight for support coordinators to ensure that they're doing quality work. And there's a lack of education. A common thing said in the community conversations was that we're teaching these support coordinators about the resources available, and it should be the other way around. And then it was noticed that the good support coordinators are leaving for different jobs. Comments, this came up in the community conversations, this came up in the survey, and it came up by our ad hoc committee, is that these same issues have been coming up for decades and things have been getting worse. And things are less accessible, they haven't changed, and disability and funding are not being prioritized. The sense in the IDD community is that the IDD community is beaten down, they're distrustful of the efforts that are intended to change. Again, I'm sick of filling out surveys and nothing happens. This is something that we talk about in evaluation. You know, there has to be better ways to encourage support and sustainability so that they can continue after that funding that initiated it ends, because people get tired of the new programs. So that's not specific in this, but it's kind of building onto that. And we talk about that in evaluation, about how we can support it, but it's a very multi-pronged approach. So planting that seed. Another thing we had to talk about was eligibility criteria. So one of the biggest challenges with eligibility criteria is that people have to be determined eligible by a certain age, and there's a lot of diagnoses that are excluded. Some parents of children with IDD don't realize that they have one until they're going through the process with their kid. And by then they're too old to receive a lot of supports, or they would have exceeded that diagnosis age limit. Maybe there's not the right paper trail, or especially through schools and stuff like that, to be able to be determined eligible at that older age. And so, and this is especially in the areas where there's a lot of turnover in the providers and just even less ability to get some of that paper trail. And overall, the tone is hang in there, be persistent, everything's cumbersome, apply, get denied, go in the circle. We talked more about underserved groups, and we talked about that a little bit when I was giving you the results, but adding to this list are people with co-occurring behavioral health issues and severe mental health impairments. And there's a lot of barriers that are excluding the services that they need. There's also the group of people with IDD that aren't medically complex, so they're on the fringe and they need help, but they're ineligible. And so figuring out a way to serve them, that group of people that need help that aren't going to be eligible. And then we already talked about the non-English speaking groups, the rural areas. I want to highlight an important example, though, of where rural areas struggle that's going beyond that typical transportation and general availability and awareness of services. So this was given by somebody in our ad hoc committee, said, you know, in Navajo Nation, there's early intervention kids that are trying to apply to Altex, but the office is closed. Then the cases get closed because the mailboxes are really far from the residences and people aren't getting their letters in time and they don't get the phone calls. And then there's limited ways that Altex is willing to communicate, which is creating more barriers for these folks. Like another small detail, but important one, is the Altex application doesn't include a spot to indicate the time zone. Navajo Nation practices daylight savings. So when people receive the letter and it says, we're going to call you at this time, the family might miss the phone call because there's that miscommunication on what time it is meant. And so, so I just kind of want to point out, you know, I thought that was a really nice example that was brought up that puts a whole nother lens in the complications of some of the rural areas.
Megan,
So,
we have a question that I missed in the chat from Kin Counts that has an issue on housing ever been voiced?
we have housing captured in the phase 1 through different reports, but it was not a commonly voiced thing by the community in that small sample that we have through the phase 2 and the phase 3.
Okay. Thank you, Megan. Ken, does that answer your question, or did you want to come on? Oh, yes, she said thank you. So thank you, Megan.
Sounds good. Another thing that was emphasized with underserved groups is that people feel like they're not treated the same as the predominant groups, and they're fearing retaliation to speak up about their rights not being recognized. And then the last one is just a note on wait lists. So, you know, DVR doesn't have a wait list, but if funding changes, they might have to go on one. There's official wait lists, there's unofficial wait lists. There was also this cycle that was discussed of like, it was given in a specific county, but we're going to bring it to the big picture of a DDD support coordinator doesn't put the service on the plan because the service is not available. And maybe you have to travel too far to get it. It's not really an option. So the service isn't available in the area, so it doesn't go on the plan. Well, now there's no wait list for the service, and there's nothing to support bringing the service into the area. And so this kind of cycle keeps happening. And so the services are needed, but you're in this desert of providing. And so it was discussed as that need to get those support coordinators trained on that big picture and the need to put the services on the plans even when they aren't available. Okay, so what I want to do, we're kind of moving towards, I'm done presenting. I got a couple things to share, but what I want to do is start getting us ready to frame the discussion, because we're looking for the direction from you to help set the direction for the state plan development. So the big picture next steps, and Marcy's going to talk about the scope of work later, but is you set priorities, a work group gets together and makes these goals and objectives. And then those goals and objectives get approved by you and adjusted. And then they go out for public comment. And then the public gives their input. If there's substantial comments, they get brought back to you. And then you decide, are we changing them or are we good with what we have? And maybe those can be addressed in work plans and stuff like that. Or maybe it's just not the direction that you want to go. But you need to hear their voice, think about it, and make a decision. And so, you know, all of this really gets set by the tone of you as the council. And so what I want to do to help us get framed into that discussion is give John and Marcy a few minutes to talk about the current state plan and the actionability of it, because we're going to be thinking about those changes as we develop the new goals and objectives. And your current state plan is big. You know, you have 5 goals and 3 objectives each. And I just put the areas up here, and I'm going to let John and Marcy talk for a few minutes before we move into our discussion. Start.
Okay. I will happily dive into that. And thank you, Megan. That was incredible information you shared. We really appreciate all the work that you and your colleagues have done. And it has surfaced a lot of great insights from our community. So again, thank you very much. I want to note, well, first of all, as Megan said, our current state plan is big. In fact, it is massive, and it is too big. One of the things we have learned one of the things we have learned over the last 4.5 years, four-ish years, is that we bit off more than we could chew. We were too ambitious, thinking that some great opportunities existed, and we were best positioned to try and take advantage of those opportunities and meet those challenges. And it has not always played out that way. Not to say that we haven't given it our best effort, not to say that you as council members have not given it your best effort. It's just, it was just overly ambitious. And so we've encountered some additional challenges as part of that, one of which is that our staff capacity simply isn't adequate to oversee all of the things that we have attempted to do and are attempting to do. Another really significant one is that as a grant-making entity, we have not seen the range of grant seekers that we anticipated seeing. And this is not in any way to disparage the organizations that we are currently funding, but I would point out to you that our current grants are almost exclusively to the USEDs, which is fantastic. We love having the USEDs as partners. But as you know from the decisions that had to be made last summer, we had to rely on the Institute for Human Development and the Sonoran Center to an extraordinary degree before the end of the last fiscal year, just in order to be able to obligate the funds that were available to us. And that's not an ideal situation. It wasn't fair to those 2 agencies, to those 2 entities, and it wasn't as inclusive of the larger community as we would like it to be. The Arc of Arizona is the other significant entity that we are funding, and we love working with the Arc. I came from the Arc. It's a great organization, and they're doing great work. But when our grantee pool is limited essentially to 3 different organizations, it's not a good look, and it's not the ideal that we're searching for. We are trying to be more expansive. We're trying to reach more of the state and spread our funding around to a greater variety of organizations that can do the work that we're trying to get done. So those are just some examples. The point, I think, ultimately is that we need to curtail our ambitions a little bit. Not to say that we don't want to do excellent work, but in my opinion, we have a better opportunity to do excellent work, we and our partners, if we are more focused, if our priorities are perhaps a little bit narrower, but that allow us to go deeper into issues. The analogy of being a mile wide and an inch deep. In a lot of respects, that's how we feel we've been over the last 5 years. I think many of our results are very good, but many of our results are not to the level that we would have hoped them to be. And so as we move forward into the next 5 years, we'd like to have a little bit more focus, like to have a little bit more control over things. And I think also my final point is, if we are not trying to tackle too much or so much from the outset, it allows us to respond to surprises that come up during the 5 years in a way that right now we're really struggling to do. You can't always predict what a 5-year time frame is going to include, and that has certainly been true of the last 5 years. There have been any number of surprises from the policy standpoint, from the at both the federal and state level. We struggle to respond to those surprises, to those challenges, those emerging issues, because our staff are stretched so thin and our grantees are stretched so thin. So I think if we narrow things down, it provides us a little more flexibility in that respect as well. Apologies for going on and on. I'm going to turn it over to Marcy for her thoughts.
I totally agree. I would only add that I think as the council members think about the next 5-year plan, one thing that I reflected on is the feds allow the councils to amend their state plan every year, but we don't have a lot of time in that planning discussion with the council. And I think that needs to be an important factor going forward, that if the council is going to make changes to the state plan, and you can make changes to the goal, which is not recommended because that triggers a 45-day public comment period every time. But we've made changes to add objectives. And the perfect example is after Hacienda, we added the safety goal and then a number of objectives and activities to support that. That was done over, the last several years to enhance that goal area. And it was important to do, and it was important to address and be a collaborative partner with a lot of different agencies and the USETs in that. But thinking about going forward in the development of the new 5-year plan, if the council is going to think about adding objectives or activities to really pull back and think about what are we trying to achieve in the number of years left in that 5-year plan, and how to make it more impactful, because we not only find it hard to figure out what can we fund and who do we fund, because as John said, there's not a lot of organizations that can take on a lot of the difficult work to do, and we cannot duplicate and we cannot fund what DDD does, so it has to be different. The other part of it is thinking about the staff that has to be in charge of doing an in-house project that is more of a systems change. And those take time to see results as you are trying to impact a system, whether it's policies and regulations within an agency, or whether you are going after legislation and statute to change. Those all take time to do. So we get wrapped around the deadline of trying to input the change in the work plan without doing all the discussion behind it. And that needs to be more prominent in any sort of annual work plan updates. And going just as a frame for you guys, what has to be submitted in this next coming August for your next 5-year plan is your first year annual work plan. So whatever your goals are, however many, 2 years of that annual work plan have to be submitted. So kind of thinking what is your frame of going forward for your first year in order for your second year to build on that. And then afterwards, obviously, with the council and staff here, we'll develop the next third year and then the fourth year and then the fifth year on an annual basis. But everything should be built upon what you are going to establish in this next 5-year plan. And that would be my own comment, is thinking about that.
Yeah, I think ultimately what it comes down to is a question of where can the council make the greatest difference? There are some systems level issues that are beyond our ability. We have a $1.5 million budget, annual budget. There's only so much that can be done. We also, we're not a policy making entity. We work on policy issues and we support research and programmatic efforts. But we have to determine where, with our staff size, with our budget size, where we can make the most difference. And ultimately, at the end of that 5 years, we want to say we started here and we ended here. What have we done? What has the council done that's moved the needle on whatever issues? And that's what I mean when I say I think we need to focus our efforts. We need to focus our goals and objectives to really see where the council can have the greatest impact. And I would note that there were some things that were not prominently mentioned in the first 3 phases of this state plan development work that really stick out to me. And I don't know what accounts for it. Maybe it's the size of the pool of responses we got. Maybe we overemphasize them. But to Kim's point, the issue of housing was not prominently mentioned. And even extending that, types of housing options, promoting independent living. That was not something that was brought up, but we believe, I think philosophically, we believe that is something that should be addressed. Healthcare, access to healthcare, availability of healthcare, specialization. These things were sort of mentioned from time to time, but they were not overarching themes in what we covered. Education, supports in the special education system, other than transition and transition to employment. We didn't hear a lot of mention about challenges with the K-12 education system. We didn't hear a lot about people wanting to move on to post-secondary education. But those are things that we have been funding, and those are things that we recognize are needs in the community. For whatever reason, it wasn't brought up a whole lot. The issue of safety, abuse and neglect is something the council's been funding for a number of years, and we think we've moved the needle on that. But that also was not something that was top of mind for a lot of our respondents. And then finally, self-advocacy and self-determination. That's a mandatory activity area for the council. It doesn't necessarily have to be a goal. It is a goal right now in our current state plan, but it was not something that was brought up a lot in our community conversations. I think because we didn't have a lot of self-advocates in the room, and we also didn't have a lot of self-advocates responding to the survey. It was mostly caregivers, professionals, and so forth. And so maybe the issue of self-advocacy wasn't as top of mind for them. But those are some areas that we have been working on, and we think we've made some improvements. And there's a lot of room still to grow. But I just throw that in there for your consideration as areas where we might want to continue some work. Maybe we don't, but there are areas that we have identified in prior years as being important, and they were not necessarily high on the priority list for those who responded to our outreach.
Thank you, both of you. And so I am gonna not share it in the results because it didn't surface up, and the whole thing is we did ask questions in the survey specifically related to housing. A couple questions, like when we asked what are your top priorities, there were choices related to housing, related to transition to post-secondary opportunities, related to self-advocacy, but that very well, you're right, could be the lack of self-advocates in both the survey and the community conversations. So a couple of those did get mentioned in the survey as choices and just didn't rise because there were other ones that came up higher priority. That all being said, it doesn't mean you can't go that direction. And so I really appreciate the two of you taking the time to help us frame this, because our first discussion that we need to talk about as a group now is what is the level of ambition and risk that you as a council are comfortable with and sending that guidance and leadership for the goals and objective development. In a moment, I'm going to put up a discussion board for us to reflect on. We'll do about a minute of silent reflection, and then we're going to open up the conversation for about 10 minutes to kind of work towards a discussion of what our a consensus of what that balance of risk and ambition should be. So, and that really helps the work group set goals and objectives, like what's the loftiness of the goals. And so kind of thinking about world peace. World peace sounds great, right? It's not achievable by any one organization. And so they're looking at what can move the needle towards world peace. And so that's kind of ultimately, you know, is moving the needle towards world peace, you know, something that you're doing in the very, in a small, like, hey, I'm nice to other people, that moving the needle? Or is it something that you're trying to make, you know, there's a whole spectrum there. And so we're trying to figure out where that needle needs to be when we're setting these. So I have a few prompts for you to think about, and they'll be on that discussion board. They're also on the discussion points sheet that was given to you, because it's hard to remember all these once we start getting into it. I put the prompts kind of in order of importance. When we thought more people were going to be here, we're going to go into breakout rooms, so we're extra prepared. But if you look back in 5 years, what would, if in 5 years from now you look back, what would the success look like for people with IDD in Arizona? What outcomes would matter most? Looking back 5 years from now, what would success look like for the council? Should success mean a few broad, deep changes in one area or broader improvements across many areas? Think about two different approaches. One, bold systemic changes that are transformational but take longer or involve a lot of risk. Or another approach, incremental improvements to current systems that build on what's working and show quicker results. What's appropriate and feels right for this 5-year plan? Which approach? Or should it be a mix? If it's supposed to be a mix, what's the balance between the two? And my fourth question, given our resources and partnerships, should we aim for goals that stretch us significantly or goals that can fit within what we know we can deliver? So I want to give you a minute to reflect on those, and you're going to be given the chance to unmute yourselves as well. But I do have a discussion board that I'm throwing into the chat that you can post. I did something weird in my copy and paste. Give me a second here. So that you can post some of your thoughts, and then, you know, during this discussion, you can upvote, downvote, and oh, it was there. Just scroll funny. But you can go ahead and react to of other people's comments. So I will share my screen while we're taking that minute of reflection. I am going to let the dog out. And there we go. And if you're
Monica, this is Monica. Are we allowed to speak on this? Because it'd be easier for me to speak.
You're absolutely going to be given a chance to speak on this. I just wanted to give everybody a minute to compose their thoughts before we jumped in.
Okay, okay.
Hey, Megan,
Yes.
is there a chance that you could enlarge the screen a little bit?
Yeah.
Okay.
Whoop, too fast. There we go.
Thank you.
And anybody that's using that link, if you click on the little plus, it does a sticky note onto the board.
We have a question from Kristen Mackey.
Thanks,
Go ahead.
JJ. I just wanted to share that from a DES perspective, there's a firewall, so we cannot add to that. So just wanted to share why you won't see anything from folks that are on the DES network.
Well, at least you can see all the questions as they show up, which was a big part of the share screen. So now that everybody's had a little bit of time to start thinking on their thoughts, I am going to open the floor. Go ahead and raise your hand or unmute yourself, and we'll start having this conversation.
This is Monica. I do feel that advocacy is very important because it enables people to speak up to themselves. And, you know, I think it's part of all national councils, if I'm not mistaken.
So
I feel like
now what I want to focus on is, so let's frame that, right? So in a few minutes, we're going to talk about priorities. And bringing up self-advocacy in the lens of what a priority goal should be is great. But right now, let's think about it in the lens of ambition. So if you were to think about self-advocacy being important, what's the change that you want to see in self-advocacy? Do you want everybody to be a huge verbal advocate? Or do you want 10 more self-advocates? And where in the spectrum should we be going?
I think probably at least 10, and then especially in the rural or the small communities.
Okay.
And expand the group throughout the state.
Expand what throughout the state?
The self-advocacy groups throughout the state.
Okay.
Because some groups that were supposed to be statewide mainly have like Tucson and some Phoenix. We're just starting to get some other parts, but I think encourage more people to be a part of groups.
Okay. So that kind of sounds like, you know, if we're adding 10 new advocates and adding a few new groups, that's on a conservative part of the spectrum of ambition. Like we're not trying to have everybody do it, which would be the far end of ambition, but kind of a little bit more towards the conservative end.
Megan, this is JJ. There's comments in the chat. Pin counts put for, I think, number one, a voice, understanding their rights.
Okay.
And then, Kim, did you want to add anything to that?
So I'm seeing that as a response to like what's success for people with IDD in Arizona, what outcomes matter most, and it's understanding their rights is what the outcome is that matters most.
And then there's also a comment. She's still thinking about if there's anything else. And then JC Park has asked about, or she noted that she requested access to the Padlet. So I don't know if you control that on your side, Megan, or not.
Theoretically, yes, but I don't see the alert, which means I think that my Padlet idea is a failed approach, and we're gonna just look at the prompts on the screen and just open the floor up. Go ahead and if you're not comfortable speaking out loud, just throw in the chat your thoughts if you don't want to speak out loud. I can see the chat now as well.
Yes. Megan, I just as a note, I don't know that it's a failure on your part. I think it's the overzealousness of state of Arizona in preventing us from using useful tools.
Sounds good. Yeah. So in 5 years, what's the success look like for the council? You know, are we looking at bold systemic changes that take a lot of risk but are transformational? Are we looking at incremental improvements? You know, do we want to stretch ourselves a lot, or are we going to try to stay with what we know we can deliver?
This is Kathy. Can you hear me?
Yes.
what I think is that, I think it'll be incremental, but I also think it's quality. Because you can have self-advocacy groups throughout the state, but are they good quality groups? And how do we ensure that they are effective? And I also think that it's not just working with the individual, it's also working with the family members so that they understand, the self-advocacy and they are behind their child or the family member, helping support them in their efforts to self-advocate. So I think it'll be incremental, but I really am concerned if we don't have any measurement of quality, then we can say we have a lot of self-advocate groups, but they're not very effective. So I don't know if we'll achieve what we want to achieve.
And Kim said we should prioritize what's functional.
Can she explain that a little bit more?
Do you want to expand that?
Were you asking me, Megan? This is Kathy.
Kim
somebody else.
had said we
Kim.
prioritize what's functional. I was asking them to expand. So I think that the input, of looking at incremental improvements that are really measurable is a great insight as to kind of that scope. It's achievable, but looking at how we're going to evaluate it. In time, we are like in March, we're going to talk about evaluation. But so it's nice that you're thinking about that now. Kim said, knowledge is power. If we could bring more awareness, education, and training to the community. Does anybody else have any more thoughts on, what's our scope? How ambitious are we going to be here? What risks do you want to take? Go ahead, John.
Yeah, this is Alexander. I think it's a good mixture of the two is a good approach, especially what Ken said about educating and training communities, especially in Arizona, since we're so diverse and we have a lot of Spanish-speaking communities and Hispanic populations. How do we teach them to be advocates and increase the amount of advocates in those communities because they're very underserved? But also, I think we should be trying to look at what can we do to improve services and the delivery of services, because there are also barriers there that are preventing people who are advocates from being able to access what they need. So I think a good balance of the two would be a nice way to move.
Okay, I saw someone else with their hand raised, but I lost the name.
Mary.
This is Mary. I think that the idea of having one pretty bold kind of statement with some more things that support that, or one pretty bold goal would be a good idea. Because I do think that that over the next 5 years in particular, we're going to be faced with a different world. We've already come through so much. We've actually, I was thinking, we're so service oriented that we aren't seeing the forest through the trees in some respects. And so I love the idea of a bold statement about the forest that we then have some particular goals and objectives that fit into that. And if I were to describe the forest, it would be something like we've come so far from only having institutions to having a complex system of community services now. But those are still increments to something. And we don't know what we're going to be facing over the next 5 years with all the changes that we're having financially and everything else. And so we're going to be challenged to do some different things, I think. But keeping our eye on inclusion in communities, in community involvement, is going to be real important to that, I think. So those are just my thoughts on the bold and incremental things that are significant in the process. That's all.
So putting the last two comments together, you know, of a mix and that bold and incremental, we're probably looking at, you know, with that scale back comments that John made, looking at shifting towards a state plan with maybe 2 to 3 goals. Like the ITAC recommends, 1 is often too few. So kind of trying to stay at no more than 3 goals. And so say we went with 3, you know, having 1 really big, bold, ambitious goal and some small and big objectives, and then a couple more incremental goals that are as maybe goals 2 and possibly if we go with a 3rd goal. That's kind of the tone that I'm hearing with this group. And then making sure that we're really looking at that quality when we put together the work plan.
This is Monica. I just have a quick question. What about, like, for example, employment or some of the ones that are good that we have now, even though it's a little too much? What do we do? Do we just get rid of them, even though they're just as important?
Well, we're going to set our priorities in a minute. And what I would say is that the goals don't have to be siloed like they currently are. We don't need to have an employment goal. We could have an employment objective that's part of a bigger goal, and that our goals could actually cross a lot of sectors. Does that answer your question?
Yes, it does.
And I see Ken put in a comment of, depending on what goals, some might need to have really bold approaches and some might be incremental. So overall, the sense that I'm getting is a mix, some bold, some incremental, maybe a little heavier to the incremental, but pick the really good impact one, something related to self-advocacy to be the bold one. Does that sound right? If everybody wants to respond with thumbs up and celebrates, if you're happy with that, maybe do frowny faces if you're like, oh, I'm in left field here. Go ahead, Mary. I think that's whose hand was raised.
Oh, yeah, that was a mistake. Sorry.
Okay, sounds good. Okay. Well, let's pivot to, let's set the priorities. So we have talked about all of the CRA results. We have talked about the issues and challenges. We had a conversation just a minute ago about self-advocacy and a couple of comments about those outcomes that we really want to see happening for the IDD community. And let's put that all into our thought process here of what is the most critical areas to direct our focus. And so my discussion prompts for you are which issues feel both urgent and feasible to move the needle on over 5 years, the next 5 years, not 25 years from now, 5 years. Which gaps are going to worsen without our attention? From everything that we've discussed, what are the 1 to 3 most urgent issues or opportunities that we must address in the next 5 years? And then given our capacity and our resources, what priorities are realistic to pursue now and which might need to wait for future plans? So again, I'm hoping you all can see the screen. If you can't, it's on that one document about the discussion details. And we'll be quiet for a minute so you can compose your thoughts, and then we'll open it up. This will be a little bit longer of a discussion. Okay, I'm all caught up with my notes. So now, if anybody wants to go ahead and chime in on some of their thoughts related to these, what's urgent and feasible, what gaps are going to worsen if we don't give it attention. So then how does that surface our 1 to 3 most urgent issues and priorities that we have to address? And let's think about our capacity and resources for what needs to wait. And go ahead and just unmute and talk, or raise your hand, or throw it in the chat, whatever works. Go ahead, Mary.
One of the things that I keep hearing come up has to do with educating people about different things or letting people know about stuff. And so I'm almost hearing that so much that I want to say it's almost like a public relations campaign or a marketing campaign. I'm just going to say it's like I'm part of the navigation committee group, so I'm kind of stuck in that category. And what I think is that it's not just about services, but it's about how do I navigate this complex system to make things work for me and what I think are possible for me or my family. And in order to do that, I need to know, well, I wonder what the possibilities are, because we're still creating possibilities all the way from employment opportunities. What's possible? I don't know. Well, give me some examples. And once I hear those things, I say, oh, how did you do that? I want to be able to do that. And so I need to navigate a system to make that happen. And if what we want to do is continue to integrate and include people in communities, it's going to get more complex, as it should. But to start with that, I need to have a idea of what's possible. And I need to start thinking about that for my family. And that all goes all the way to navigating my possibilities. That could be self-advocates. How do self-advocates navigate the possibilities? How have you done it? How families done it? And I keep hearing about support coordinators. Those are some of the people that if you don't have self-advocates and other families, those are the people you kind of count on. But I keep hearing things about they really don't know the system. They just know how to plug into different services. But how is all this supposed to work as a whole? And I keep coming back to, how do people learn about this? What are the possibilities? And so that leads me to some kind of how do you spread the word? And pictures of possibilities. Because once people get an idea of what's possible for employment, it's like, okay, yeah, now how am I going to do that? So I think it fits into any kind of category of services that we're talking about. But it does have to do with kind of helping somebody build their own boat to navigate this system. And so that's my comment. So it's a critical area, but there's lots of little pieces to it. Could be lots of little pieces to it. That's it.
Kind of integration of self-advocacy and awareness that go hand in hand together to then make a broader impact on overall community awareness.
This is Monica. I'd like to add, there should be more also, when you talk about how to navigate, there isn't very much plain language for the self-advocate with a disability to understand.
Okay, that's a great point.
I like the word you used, Megan, the awareness. It's almost like the awareness of possibilities from the people who have already navigated that.
This is Kathy. Can you hear me?
Yes.
So I really like what Mary and Monica said. I think one of the priorities has to be system navigation and access. It's key, I think, to getting the services you need and building up, building your life.
Great. What other thoughts do people have? Are there gaps that are going to worsen if we don't direct attention to it? So think about some of the things that John said, that really didn't come up especially in the public input data collection parts. Comments were made about housing, safety, and then some of these secondary opportunities. And, are any of those going to get worse if we don't give it our attention and that we could move the needle on?
Okay.
I believe, this is Mike, excuse me. I believe that if we don't provide a focus on post-secondary education, increasing awareness that the disparity is going to increase for people not to obtain employment, not to pursue post-secondary education. So it's sort of like that metaphor of the Emerald City. It would be great if that's the goal. How do you get to the Emerald City? And all of these different paths are going to help you get there.
So, we're going to have a bigger gap on people who move towards employment if we don't do addressing, looking at inclusive post-secondary, different types of training and opportunities, either college or vocational training, and really capturing that. Some of it's awareness of those opportunities, but also the ability to fully participate in those opportunities, and that employment gap is going to continue to worsen if there's not focus in that area.
So I think, as Jason, I think that we're going towards, under what Mike said, I think we're going backwards towards institutionalization again. And we don't focus on stuff like employment awareness. People are gonna end up back there, especially within, the way the policies are going. I think it's going backwards, not forwards. And I hope that makes sense.
So without employment awareness, we go backwards towards institutionalization.
Yeah.
Mary, your hand was raised.
Yeah, I wanted to add on to that. Yes, that's what I'm thinking about in terms of that storytelling that says, why are we doing all of this stuff? Where is it going? And it's not just that this service and then there's this one and then there's this one, but there's all some purpose and there's some scheme in here about what it's doing for somebody's life and where they're going with it. So it kind of keeps that direction going, to say that the story is you get to help navigate your own course and you're going and you're creating things along the way. Because I think lots of people are going to need a support in creating that force over the next 5 years. But it fits right into what you're talking about with elementary, secondary, and graduate or otherwise. And it's like, we're doing this for a reason. There's more to it than this.
So almost something that is, building off of the earlier conversation about self-advocates teaching how to do the navigation and increasing the awareness of the possibilities. Another component of that priority is really building more people's self-directed personal strategic plans of what they're going to do in their life. And that starts with their understanding what the possibilities are so that they can set a long-term goal of what they want over their next many years of their life. And then having the awareness and the possibilities and then charting a course of how to get there. I wonder, earlier when we were studying the ambition, you had that metaphor of can't see the forest because of all the trees. And we recentered ourselves or had a good explanation of what that forest looks like. And I wonder, does that filter in to any of our priorities?
I will just say, this is Sarah. We are not talking about AI enough. It's going to change everything with employment and everything else. So I would love to see that in the 5-year state plan somehow. There will be benefits to folks with IDD. There's also going to be a lot of jobs eliminated they would have qualified for. So we would be neglectful if we didn't bake that into whatever we create.
Yeah, I think AI has an effect on resumes. When you turn in a resume, and AI can disqualify you off the bat without actually understanding what you can actually do. I mean, that's a barrier for people with disabilities in some respects. Also, talking about paying the forest for the trees, if you look at DDD's person-centered plan, the people going to tick a box, and then they don't really go towards that person-centered plan. So it's more than just ticking a box. And sometimes I think that the forest is good, the box. They go through all these requirements, but then nothing ever happens. So that's part of the issues as well. And Mary has her hand raised, so.
I'm sorry, I forgot to take it off. However, I love the idea of something about AI. It's like utilizing new possibilities for a positive effect and learning how to do that. I love the thought of having that included.
This is Monica. I agree.
This is Mike again. Monica mentioned plain language. That is very important, but I'd also like to suggests that everything that we do is more consumer centric, focus more on the consumer, eliminating the use of acronyms and abbreviations, but really talking in plain language and having the focus for the general population. And I think that absolutely technology is merging so quickly. We talked earlier a little bit about assistive technology. You talked about supportive technology, but I think that technology should be embedded in everything that we do, or using technology to help us get there.
I'm putting a lot, or taking a lot of this and just listening. Eventually, we'll shift towards, you know, picking the top priorities and really just hearing everybody's input, because a lot of this input can filter into the state plan at a lot of different levels, right? You know, maybe a goal is made about AI, but maybe that is an objective or an activity underneath each of the different goals. And so kind of thinking about it, like there's a lot of different levels where all of this input can come in. So keep it going, and then in maybe 3 minutes or so, we'll start trying to then surface what the priorities are from the discussion.
And Megan, I feel a need to do a time check. Just so you are aware that we're coming down to the last few minutes of the meeting.
No, I lost track of time completely. Thank you. Okay, so if I was to surface the priorities from all this, and then I'll hand over the thing. You know, I'm hearing self-advocacy is a huge priority, and then integrating that with awareness and increasing the community awareness, but the broad reach of awareness. It's not just reducing stigma, it's also the awareness to really empower the people with ID, that we're ultimately at the end people we're serving. And then and then making sure that we're being forefront with technology and looking at how that threads into things, and then using everything to be captured, you know, accessible to the people, and using looking at that, you know, always centering everything back on the end, the consumers and the community, not the consumers, that's a VR term, the people with ID, the community, and that centeredness. And then I think that everything else that we've talked about really falls under those different priorities that I'm hearing. Okay, I was supposed to take time to talk about the initiatives that are under our current activities, but I think that we can do that when in January, when we talk, because we'll filter them into the work plan. So when you set the goals and objectives after the work group, that will work well. So I think that's everything that I needed to talk about before I hand the baton.
Well, thank you, Megan. This is JJ. John, I'm just going to kind of, where do we want to go? Obviously, we're not approving the plan today. We don't have quorum, so are we just continuing the discussion in January, or are we looking for the council to support this going forward when we do conduct a vote? What would you like the council to do at this point?
Well, if there are any council members who have comments, questions, concerns related to the scope of work and the contract renewal, they should submit those items to me. We will be needing to get an executive committee approval of the contract renewal prior to January 1st. So if you could get me any comments, questions, whatever, in the next week or two, that would be ideal. The contract will take effect on January 1st, so we want to make sure that we have plenty of time to get things in place. Otherwise, I think we're good.
Okay. As an executive committee member, John, if you do receive comments, concerns, etc., just if you wouldn't mind forwarding those, just so that then at the next executive committee, we have all the information you have, which will shorten our discussion and ultimately our vote. So we'd appreciate that.
Yeah, absolutely.
Awesome.
And to expand on your question, JJ, like basically today, we're really getting the guidance from you. And then a work group, and this is outlined in the scope of work, a work group is going to get together and develop the goals and objectives, which are then going to come to the council for a vote. And then we'll go into, once the council approves those goals and objectives, we'll go into the public input period and proceed with the state plan development process. So everything that was given today really gives the work group a lot of direction.
Great. No, thank you for that explanation, Megan. And then for the council members, you know, you heard Megan say there's an opportunity to be part of a work group to further work on this. So I know we did have some voices at the table today. So if that's something you are able to do and add that to your list of many things I'm sure you're all busy with, that would be greatly appreciated. So again, thank you, Megan. Really appreciate it. I know this is a lot of work and effort, and for you to facilitate this is really helpful in setting the goals going forward for the council. So appreciate your time and all the work that you've done and will do. So we only have a couple of last agenda items. Any announcements from anyone in the room? Not hearing any. Next agenda item is G, which is called a public. I know we at the beginning of the meeting had some folks, generally anybody in the call to public who would like to make a comment, ask a question. Okay, not hearing any. I'll take the opportunity just to wish everybody happy Thanksgiving and a time, because I know we won't see each other for a while. Hopefully your holidays are nice as well. I really appreciate your patience with me. Again, I haven't had to lead a council meeting. You all were very nice and appreciate that, and appreciate the participation. As always, I will take a motion to adjourn.
Oh, we actually don't need a motion to adjourn.
Okay, well then we are adjourned. Everybody have a good rest of your day. Happy Friday.
Thank you to everyone.
Thank you, Megan.
Thanks, everybody.
Thank you.
Thanks.